Can abstinence prevent HPV and reproductive cancer? Imagine a way to completely avoid certain health risks. Abstinence from all forms of sexual intercourse, including vaginal, oral, and anal, is the only method that guarantees no human papillomavirus infection. Since HPV is primarily transmitted through skin-to-skin contact during sexual activity, avoiding all sexual contact removes the risk of exposure entirely. This means that if someone chooses abstinence, they will not contract HPV and therefore significantly lower their chances of developing HPV-related cancers like cervical, penile, anal, or oropharyngeal cancers. Human papillomavirus is extremely common and is the main cause of cervical cancer, which is one of the most common reproductive cancers worldwide. Many people who are sexually active will encounter HPV at some point, but most infections clear up on their own without causing health problems. Persistent infection with high-risk HPV types is what can lead to cellular changes and, eventually, cancer. Because of this, preventing HPV infection is a key part of reducing reproductive cancer risk. While abstinence is the most effective way to prevent HPV infection, it is not the only strategy recommended by health authorities. Vaccination against HPV is highly effective in preventing the most dangerous types of the virus, especially if given before any sexual activity begins. The vaccine can significantly lower the risk of developing HPV-related cancers later in life. Using condoms can also reduce the chance of HPV transmission, but because HPV can infect areas not covered by a condom, it does not offer complete protection. Limiting the number of sexual partners and practicing monogamy can help lower exposure risk but do not eliminate it entirely. It's important to recognize that HPV is very common, and many sexually active people will be exposed at some point. Early detection through screening, such as Pap smears for cervical cancer, plays a vital role in catching any cellular changes early and preventing progression to cancer. Combining vaccination, safer sex practices, and regular screening provides the best overall protection. In summary, abstinence from all sexual contact guarantees no HPV infection and thus prevents HPV-related reproductive cancers. However, because many people are sexually active, public health strategies also emphasize vaccination and safer sex practices. These combined approaches are supported by scientific research and guidelines from organizations like the World Health Organization and the Centers for Disease Control and Prevention. Always consult healthcare professionals for personalized advice, but understanding these options helps make informed choices about health and prevention.